Hello, I'm Hayley. I'm a laser technician of over 20 years and I am here to talk to you about laser tattoo removal, what it involves, how it works, aftercare and all of that. So laser tattoo removal is becoming increasingly popular because tattoos are becoming more popular and people just change their mind, obviously. And it's been around for around about 30 years. It was actually introduced in Glasgow in Scotland by a very, very good scientist, somebody that I know actually, and he's wonderful. And technology has moved quite a bit, but the fundamentals are still there. And tattoo removal is one of those treatments that's a little bit more difficult when we're working with clients because unlike hair removal, which is a lot more structured and a little bit more, not guaranteed, but you see the results a lot quicker, tattoo removal is slightly different. And when people have decided they want a tattoo gone, they want it gone and they want it gone tomorrow. They don't want to be told that it's going to take a couple of years for that tattoo to fade to where we want it. And they don't understand the concept of it and how it works. So, lasers, majority of lasers target colour. That's what they're looking for, a form of pigment. And this is the same with tattoo removal. So the laser is looking for the colour in the ink as a target. And we choose different wavelengths according to what colours we're working with. Now, ourselves, we have 4 different wavelengths, 1064, which is the YAG, 532, which is KTP, half the YAG, obviously half of a 1064, that's for more coloured inks. We use a 694 for, which is a ruby, which is for green inks, and we also use a 755 Alexandrite. So we've got all the different wavelengths to treat every tattoo colour that is treatable. When we're treating tattoo removal, the laser is looking for the colour in the ink, and it comes out of something like this, okay? And we use large spot sizes to start with because we get a deeper penetration. And it picks up on that colour in the ink and it shatters the ink particles into smaller particles, which allows the body's cells to break them down easier. Now, when you have that tattoo done, what your body does is it surrounds the ink with proteins, okay? And that tricks the body into thinking there's nothing untoward going on. This has always been here. Whereas if you compare that to having a piercing, a body piercing, or getting a splinter, for example, the same process doesn't happen. So these proteins are protecting that ink from leaving, it's keeping it in the skin. And what the laser does is it shatters the ink particles into smaller particles, but more importantly, it breaks down those surrounding proteins, which allows the body's immune system to go, that shouldn't be there, send in white blood cells and gradually start fading those ink particles over the next few weeks and months. And this is where patience is really, really important because unlike hair removal, you don't see a result straight away, you don't see it so quickly. You as a client, we then send you away and you're looking at this tattoo every day and you're waiting and you almost forget what you started it like, you know, how deep and how dark it was to start with. And people do get impatient with that. It does take time. When we are doing a tattoo, consultation, like all of our treatments, are absolutely key. They are priority. We are putting a laser to the skin and we are burning ink in the skin. So we are causing a burn. And with tattoo removal, there are risks of blistering and crusting. That's not what we want to achieve. So we're not going in wanting to blister and wanting to scab, and we certainly don't want to see bleeding, but it's a potential risk and it's very dependent on each client and how deep the ink is as well, because if it's really deep ink, again, I'll get my skin diagram. If you're working with ink that's really, really deep, it's going to burn all the way down through those layers of skin, and that's going to increase the risk of scabbing and blistering as well. So it's really, really important how you maintain it afterwards, but that isn't what we're looking to achieve. So I say to my clients, it's one of those treatments where people panic if they haven't seen an extreme reaction, and they panic if they have seen an extreme reaction. It's a lot of hand holding. It's an acoustic laser, which means it's all about the sound. We want to hear that clicking to see that we've got a response. And when you see it visually, you get something called frosting, which is immediately where the laser lightens it looks like it lightens the ink on the skin. And it's not actually doing that. That's just the chemical reaction from the heat. It looks really satisfying. Within 15 minutes, half an hour, that goes back to normal and it's done. It's those next few days and weeks that we are going to start seeing that fading. Now, what has an impact on the treatment? So when we do your assessment, first of all, we'll look at the colours of the ink. The darker the ink, the better the end result will be. It struggles most with greens, blues, turquoises. Yellows and whites are practically impossible to completely remove. So we can't promise you that at all. So first of all, looking at the colour of the ink. Secondly, we're looking at the depth of the ink as well. So when we're working with line work in comparison to shading, the shading is going to go so much quicker because it's not as deep in the layers of the skin. So it's going to come out a lot quicker, a lot easier, a lot softer. Whereas line work will take a little bit longer to remove, and sometimes you can get a little bit of scar tissue in that line work as well. And when we're working over scar tissue, which is much more fibrous skin, it's going to take even longer to get rid of, and sometimes we just can't completely guarantee it's going to completely go at all if that ink is trapped in that scar tissue. The next thing we've got to take into consideration is the placement of the tattoo. So whereabouts on the body is it? If it's close to the heart, around the trunk, then we tend to get quicker results with that. And the reason for that is we're working with your body circulatory system. So we're relying on your immune system and your lymphatic system, so the second part of the circulatory system, to shift that ink and those toxins through the body. So the closer to the heart, the quicker that's going to happen. So when we're working with tattoos that are on the fingers or the hands and the feet, that's going to take so much longer to get those end results. Finally, another thing which is really important to take into consideration is the client themselves and their body's immune system. So if we're dealing with young, fit, relatively healthy people, it's going to fade quicker. But we quite often see women and they might have a tattoo removal treatment. We might see them, they might fall pregnant. We don't then see them for at least a year. And because their immune system is boosting because they're pregnant, it tends to fade really, really well. Whereas if we're seeing somebody that's a little bit older, certainly somebody that's a little bit unhealthier, smokers, people that are immune compromised, that's going to take a toll on the removal and it's going to take longer. This is where it's really difficult. Tattoo removal, clients always come and they'll send me a photo of their tattoo and they'll say, how many treatments do I need? That is not a question that I can answer. If anybody says to you, looks at a tattoo and they promise they're going to get rid of that tattoo in 4, 6, 26 treatments, they can't deliver that. They can't promise that because they don't know what's going to happen. They don't know how your immune system's going to deal with it. The other thing to take into consideration is how long is left in between appointments. Now, from a business point of view, if I want to make loads of money, I'm going to treat you and I'm going to treat you every 4 weeks. That is not what is best for the client. I'm not considering your skin recovery and I'm not considering financially your wallet either. You need to allow enough time in between treatments for your body to do what we want it to do, what we're asking it to do, for your body's immune system to work. Now, we might do your first appointment and then we might do your second one 6 weeks later, 8 weeks, 10 weeks, but very quickly we are going to get you up to 12-week intervals. And we're allowing so much more time then for your body to do what it's got to do. It might slow down, the fading might slow down towards those latter end of the 12 weeks, but it's still fading at that point. If we see you at 6 weekly or 4 weekly, then your skin's not going to have recovered in time and you're going to be spending a huge amount of money with us as well. You know, like that's the difference in having 4 treatments over a year or having 12 treatments over a year, say. And financially, you're going to spend a lot more. The skin is going to be under a lot more pressure and you're not going to get any more healing or any more fading than if we were treating at 12 weekly intervals. So that's really, really important. And when clients then say to me, well, how many treatments am I going to be needing? That depends. You know, are you going to listen to me and come every 12 weeks or are you going to listen to someone else that tells you to come every 4 to 6 weeks? That's going to have an impact on how many treatment numbers you're going to need. Post-treatment, so tattoo removal hurts. Like they hurt putting them in the skin. Of course they hurt taking them off the skin. We are using a lot of heat and it's uncomfortable. It's very, very quick. We've got excellent technology and it works super fast, so you're not going to endure it for too long. When we're dealing with really large tattoos, we break it down because, again, we need to enable your body enough, give it enough of a chance to do what we want it to do. So we do it in like little pieces rather than doing a whole back piece in once. We'll break that down over time. And post-treatment, we put a lot of heat in the skin and we expect to see frosting. We expect to see swelling. As I mentioned earlier, blistering and crusting, it's a possibility, but it's not what we want to achieve. We will immediately afterwards post-cool the skin, apply either aloe vera gel or an emollient cream, whether that is bepanthenum or lantanoa or aquaphor, whatever it is. All of those creams, what they do is they enable the skin to retain moisture and keep the skin nice and calm. And then we will dress the area, we'll bandage it up and send you away. Now, off you go. We're not going to see you for a good few months, and it's really important for you to manage that area post-treatment. If you have any problems, if you have any concerns, if you get blistering or crusting, give us a call, let us know. We will assist you and talk you through how to manage it. We don't want you to pop the blisters because we don't want to introduce risk of infection. It's all about keeping the skin cool, keeping the area clean. And if you do get a problem, like I said, just let us know, but be prepared for it to be a little bit nasty and the recovery to take a little bit of time. Itching is really common and it's a pretty good sign. It means the body's immune system is doing what we want it to do, but it will drive you absolutely crazy. So be prepared for that as well. Technology we're going to talk about. So we have a couple of clinics and we've got a couple of different systems that we use. So in our Basingstoke clinic, we've got a Q switch, a Sclepion, Nanostar C, absolutely fabulous, 3 different wavelengths, and we've also got the possibility to use fractional, which really helps with scar tissue. And in our Hedge-End clinic, we've got the Picashore, which everyone knows because I shout about it. It's like a big unique selling point, and I love both of them. So the difference between the two, the Asclepion is a Q switch laser, which means it works at a billionth of a second, okay? The Pico it works on picoseconds, which is a trillionth of the second, so it enters the skin much quicker. Both of them are fabulous technology. Picashore tends to work a little bit quicker, so we get results quicker. Statistically, the clinical studies are showing about 25 to 30% quicker fading. And what drives me mad at the moment with the technology that's being used in this industry is that so many places are opening up and they are using really bad technologies and really bad techniques. And we see a lot of clients that have had treatment and they've got terrible scarring and just not the results you were expecting, and have been put through a lot of discomfort during it as well. So the right technology, whether it's Pico or Nano, doesn't matter so much as long as it's safe and as long as it's being used correctly. So when we're doing tattoo removal, best practice is to start with larger spot sizes. So these two here, you can see we've got a 4mm and a 5mm spot size. We've also got a 6mm available, and we use a 6mm on the Picashore, and we will always start with the larger spot sizes. And the reason being, the bigger the spot size, the deeper the penetration. So we want to clear that deeper, darker ink to start with. We don't need to treat you high, it just needs to get a reaction and it's gonna fade. So you always wanna start at these big spot sizes. We don't ever drop less than a 3mm spot size, and that is very, very rare, even when we do that. When we're working on more surface ink, we don't need to. If we're using smaller spot sizes, it's going to be a lot more aggressive, we're going to cause a lot more damage to the skin, and that's not what we want to achieve. Also, what you can find is sometimes if people start with smaller spot sizes, they clear the surface ink, but you've got this big shadow of the ink underneath the skin, and that's not what we want to achieve either. That's really difficult to get rid of, much higher risk of scarring, much more ablative to the skin. The other thing I see quite often is people when they're doing tattoo removal, so these things here, this is giving us our guide on how close the tattoo needs to be to the skin. And it needs to be like this. We need to treat it on the skin. This is telling us exactly what we're treating you at. I see people doing this. They've got no idea. They don't know how far or away they are exactly. And if you think of using a torch, if you've got a torch to your skin and you pull it backwards, that torch it changes shape and it changes the intensity of the light. That's exactly what's going on with the laser. So it might say that we're treating you at 2 joules on the laser, but in fact we could be treating you at an 8 joules without even realising it, and we're going to cause much more trauma, and that's when we're going to get the risk of scarring. So please really do your research. This is not a toy, it's not something to play with. These are really dangerous lasers, and the last thing you want to do is get rid of the ink and be left with a really nasty scar at the end as well. Semi-permanent makeup removal. So it's a form of a tattoo. Slightly different inks are used and a very different technique is used. And again, becoming increasingly popular, we do a lot of brow removal. But we do have to work it slightly differently to tattoo removal because it's not as deep in the skin and the inks are slightly different, which in most cases, I'd probably say 50–60% of the cases means that it tends to be an easier removal process, but not always. When we're working with semi-permanent makeup, quite often those artists have used a couple of different ink tones. So you've got a more ashy dark tone and they mix it with a redder tone. And that's to get the perfect tone for each individual client. And us as laser technicians, we don't know exactly what has been used and the amounts of each that have been used until we sort of touch the skin with the laser. We don't know how it's going to respond. So your test patching it's always a requirement anyway, but even more, just this is vital. We'll test patch the skin and that will give us an indication on how much red ink is in the skin as well. The dark ashy tone is easier to get rid of. We tend to get rid of it upon the first appointment, if I'm honest. When we're left with that pinky, reddy, orangey hue, that can be more difficult to remove. And that's because it contains different types of metals. And when we touch that ink with the correct wavelength that we're seeing in the skin, it can have a chemical reaction and oxidize, and it can turn it then from being a reddy, salmony, pinky, orangey tone back to black. But it's not turned it to black ink, it's changed the compound and it's now a black metal, which is much more difficult to get rid of, because some people will say, well, it's fine, we'll just treat it like a black ink tattoo. It's not quite the same. It's a much bigger molecule, so it can be very, very difficult to get rid of. So it's a lot of test patch, treat, come in, retest, see how it reacts, treat. If it leaves a yellow tone, we can't get rid of that. Sometimes we can only get so much of the red gone before we would then send you for saline solution with a semi-permanent makeup artist. And it's all about being completely honest with you guys as clients, letting you know everything that can possibly happen, and working quite closely with the semi-permanent makeup artist to get those end results. The best thing to do with regards to tattoo removal when you're looking into having it done is come in for a consultation. Consultations are free of charge. It allows us the opportunity to assess the tattoo, explain the process fully, test patch the skin, give you, the client, an indication on how it's going to feel, what to expect, how the skin's going to heal, and then go from there.